So in the afternoon, we had group work, and when we come to presentations and group work, we started with the Secretariat welcoming participants and taking us through the schedule of events, the program, the work program. That was followed by 5 very important presentations. But nonetheless, we are here to do it in a more organized manner, in a more scientific manner, in a different way, so that we don't do our work business as usual. I'd like to introduce CCM Evolution Project. And it was a follow-up to what the PS had done. And then we had, for me, and maybe a couple of you, a new concept, appreciative inquiry.
I'm going to focus on 3 areas because we have to prioritize. We can't talk about everything. So the 3 most important areas I thought were coordination and management of the response, mobilization and resources tracking, and community-based systems and civil society strengthening. There are management weaknesses in 3 key areas. The first is governance and oversight. The second is procurement management. And the third is financial management. Okay, let's talk about mobilization of funds and tracking resources. You all know, that you don't need me to tell you, that we have severe financial constraints and we have funding gaps, and at the moment it doesn't look like the programs would be sustainable at all if our donors pulled out. And of course, not just the Global Fund, but PEPFAR, which is a huge donor compared to the Global Fund, other donors. And if we use HIV as an example, you're going to have a problem. You're already having a problem trying to get to these 90-90-90 targets. And that's just to do with ARVs, not other program activities that are not related to medicines. The bottom line message is this: if we don't want business as usual, we have to step up, as we would say in the UK, and probably the States too. We have to rise to the challenge of the CCM evolution and the CCM transformation. So this is the end of my presentation. Thank you very much.
This is about change and how can we do better. Let us seriously discuss, seek clarifications, and more importantly, use the opportunity of being one of the 16 to better ourselves. Any questions? Any areas of clarification?
You mentioned something like our fund request is missing some sort of bigger picture, meaning that we have to look beyond HIV and TB and malaria. So I didn't understand clearly what you meant.
Let's really reflect ourselves and say, why is it, as part of our theory of change, we've got 18 months? If some of those issues has been chronic, as you said, Fatma, so what are we going to do differently in 18 months?
Sometimes I don't understand Tncm, whether we have a common culture, the membership, which is Tncm culture that is known across the members, because some are there to criticize and some are there to complain. So I think we need to look at a common goal as Tncm, shared concern, shared vision, and also conclusions that are coming as a part of shared as a Tncm, not as an individual constituency.
My question is very simple and specific, and that's based on your presentation. Currently, we all know that the Global Fund focuses on the 3 diseases, TB, malaria, and HIV. And obviously, if we want to measure how effective that grant is, one, you must have to measure the extent to which the drugs and medical supplies timely and adequately reach the patients. And that's to do something about procurement supply chain. Surprisingly, in your challenge, in your presentation, you have skipped that aspect of procurement supply, which to me seems to be the big frustration. Because if these drugs doesn't reach the recipients, the patients, timely and adequately, then probably the entire grant objective will be frustrated. So the question is why you haven't said a lot on procurement supply chain.
As of now, there is this global coalition on primary prevention. So I think in our recommendation as a country, we need to see how are we going to strengthen the multi-sectoral interventions or coordination. Also, we should also base on the 3-1s principle. And I think by doing that, it will help us even to be focused and also to have one vision and mission towards what we really want to meet as a country.
Also happy to see that you mentioned the issue of integrating RMNCH and HIV programs. Because for us as young people, we not only look for, in a way when you look for HIV, we look for prevention. And we try to prevent it more. Because being in Tncm, being in this much talk, I also say we base on treatment. But young people, we want to prevent them being infected so that we talk less on treatment.
Young people have spoken. And it also reminds us of the need to involve and engage young people. Sorry to say, some of our own policies and strategies are not very youth-friendly. And if those are the reference text that we use for developing proposals, let's not be surprised that we end up with a not so youth-friendly request. And yes, it's quite true, we are getting increasingly treatment-oriented and less and less and less prevention-oriented.
I have a dream to see Tncm that is united and delivering as one.
On the priorities. And out of that, I think last year we only had something like 12% went to prevention activities. That is a tiny amount, and so it has to be very, very well spent. But now we have such a focus on the medicalization of HIV, unlike the earlier years when we focused a lot on prevention and the multi-sectoral approach. So now, as a result, we have a very medicalized approach. It means that we are much more narrow in our outlook in terms of what we're doing for, say, HIV. The other issues that were discussed, I absolutely agree with. The reason I didn't address PSM, I actually said it. I said that I wasn't going to touch on PSM, even though it's one of those 3 big challenges at the beginning. And the reason for that is there's so much to talk about in terms of PSM, and I'm not the best person to do it, because although I wrote quite a lot about it in the paper last year, obviously that was written nearly a year ago now, and things are changing, and I don't have the most up-to-date information about PSM. But I could only talk about the problems with the drugs and procurement, because that is what I was told last week by the programs. So finally, I think somebody raised the issue of the fact that we seem to have a culture of criticism and complaint in the Tncm, and I think that that is what the new approach is trying to do, starting from looking at the best of things, appreciative inquiry, right through to our theory of change. If we can get rid of that culture, if it does indeed exist, if we can have more meetings like this, where we're not brought together just to push the proposal through, but we're brought together to talk about issues that respond to emotional intelligence, to how we manage ourselves as the group.
As we move through the day in terms of our group work and, our visioning around what do we dream, what do we desire, how do we design it, and then how do we get there. And so one of the things that I use, particularly when we're doing appreciative inquiry and we're looking at the 4th D, okay, we've done great visioning, we have a very motivating and positive future that we want to achieve, and we're trying to plot our way now from here to there. And I think most of you are familiar with this tool. We use it a lot. Strengths, weaknesses, opportunities, and threats. So I guess what I just want to do is remind you of that as we get to our 4th D, what are our steps? It's useful to know, okay, today, what do we have as our assets, our strengths that will enable our progress, right? Where do we have gaps that we need to fill in terms of getting there? right? So these are our internal issues, strengths, weaknesses, right? And then as we look in our environment, as we look a bit beyond ourselves, what is the broader environment for CCMs? Where do we have opportunities in our environment, right, that can capitalize on our strengths, can leverage our strengths? And where do we have threats, right, that can undermine our progress?
Lakini tunapo submit ile proposal tunakuwa tumesha mark nani apate, si ndio? So we know for sure kwamba this proposal pia rawani atakuwa
lakini sasa ilikuja
subject to approve.
Kwa mfano mwaka jana kwenye PR moja ilibidi aondolewe katikati. Licha ya kwamba tulishamteua. Naona yani ilifika mahali baada ya kusubmit proposal Global Fund wakaondoa kitu.
No, the problem here, we have a lot of resources here. It could be financial resources, it could be human resources, it could be whatever. But as far as this group is concerned, I think our task is concerned is about the financial management. So the strength should be specific to the financial management. I thought so.
Resource allocation.
Yeah. Okay.
On the previous exercise, we also identified that we have the right frameworks in place.
So our dream was to see that all the process to get the representatives go through the criteria who are able to sit and make a productive decision.
Can you also take the example of the global funded grants? Because now we've got the dual financial tracking. Right. The same resources come to the country, but there is that share between the public sector and the non-public sector in the implementation of interventions that we have identified it together, the intervention. But when it comes to resources, we say, okay, the private sector will manage this, and the public sector will manage this aspect.
Tncm evolution with what you said, you know, so the theory of change, whatever it is, it will
so those who will be engaged,
yeah.
thereafter will not be able to comprehend.
So the government per se, the very first contribution is continuously building a sustainable health system. That if you want to quantify, it takes a very huge amount of the funding. Yesterday I just pointed out kwamba PRAG takes 21% of the budget.
In our discussion, we had many challenges, and we use SWOT analysis as part of guiding our discussion, but all the challenges, we try to address them in a positive way and see how it can work for us, our country, as a Tncm, as we move forward.
And today's discussion, we have SWOT and the same group. Here, we have strengths, and a number of them. And here we have political will to have Tncm. These are strengths.
Coming to the weakness, we said there's a lack of business coalition for business, and there is no strong corporate social responsibility among the private sectors.
And then the other big one, I think, which we are talking there is in terms of the health financing reform towards the universal health coverage. Imagine if all of us in Tanzania were the health insurance, what sort of funding would be there really available? Even the issues which we are struggling about, money for essential drug, will not be there. So there will be plenty of money to deal with the core issues of health, but also to do the system strengthening.
Then with threat, we have high donor dependence. That's one of the key issues discussed by other members as well. Sensitive agendas like KVPs, especially constituents with MSM, can't be free discussed. Low motivated program level staff due to reduced salaries in the Global Fund currently. So on the strengths, I think we are still writing good and successful proposals. That's our strengths.
Opportunities, meaningful engagement on Global Fund dialogues and process. We have to complement that. We are part and parcel of the process of that. As non-stake actors, we work together with program peoples as well as government officials. Members to management and oversight committees, we have opportunity, and sometimes, not sometimes, always, we have equal chance when it comes to discuss issues.
Our desire is to ensure that malaria is eliminated, TB forgotten, HIV/AIDS controlled, and by 2030, we don't have any other infection. No effort that can help us arrive at that end should be ignored. And if civil society organizations have a role to play, let us recognize that role openly and the cost behind their role.